Hello, everyone. It is Friday, and I'm so glad you are spending the end of the week with me. We have a phenomenal show lined up for you today. We're going to be taking you to Rwanda, where you will know that a nationwide lockdown has been in place. It was due to end this weekend, but it's been extended. We're going to take you to Kigali for a live report. We're also going to be talking about food security and how that is being threatened right now by this pandemic. We're going to be talking to a chef who is going to be live from Accra, Ghana, another city under lockdown currently. And today's bright side is Nollywood royalty. Banky Wellington is in the house, ladies and gentlemen. He'll be joining us in a little while to talk to us about not only how he is coping in this moment where we're all readjusting our lives, but also what he's doing to help make the lives of the vulnerable better. All of that and so much more. Let's get started. All right, let's start in Rwanda, a country whose recovery from a brutal genocide that claimed the lives of nearly 1 million people, a country that has transformed into a nation that is known now for innovation and for tourism and for being the premier destination for conferences on the African continent. It has an economy that is the envy of many nations in Africa and, in fact, around the world. But all of that hangs in the balance now. All of that hangs in the balance in Rwanda, as it does in many other places, because of the coronavirus pandemic. And the question now has to be, how does Rwanda make its way through this moment? It had posted remarkable growth, but that is itself in jeopardy now. We found out about a day ago that the IMF has just approved emergency funding to Rwanda to the tune of about $109 million, the first country in Africa to receive emergency funding from the IMF. Important funds needed at a critical time. We'll be asking the journalist who's about to join us what the priorities are for that spending. The lockdown that I mentioned at the top of the show, that was put in place on March 21st, and it was supposed to last for 2 weeks, end this weekend. It has been extended now. In terms of cases there in Rwanda, when it comes to confirmed cases of coronavirus, the latest numbers that we're seeing are 84 cases. That's the latest we had seen there, and we want to get an update on that. So let's just get to it. Let's go to Albert Rodatsimboa. He joins us from Kigali. He is a journalist and is in the know. Albert, can you hear me? Albert, can you hear me? For some reason, he has just gone. Albert, can you hear me? Are you there? Can you hear me now? This screen is completely frozen, which is completely surreal as I had a Oh, there you are. Oh, there you go. The tech. So where you are there. Okay, so sorry, I'm just trying to make sure that you hear me. Did the Rwandan government give any explanation for why they extended the lockdown? That's so weird. He was there and then he stopped. Or is it just a delay? Albert, can you hear me? Okay, let's work on getting Albert back.
I feel like I'm there. Can you see me? Can you hear me? I'm there. All right. Yeah.
I can see you,
I'm
Albert.
okay.
Just
Can you hear me?
all right. So let's go with that. What did the Rwandan government say? I can.
Well, the same kind of explanations as okay, same kind of
Go for
explanation
it, Albert.
as
What did the
when
Rwandan
when it
government
started
say?
actually. There was a good reason why to do it. So, well, explaining why we had to go through this
Okay, we're
is
having a crazy delay with
it's
Albert. Let's
about,
take a second to
all right. Can you?
re-establish
I
contact
can.
without this
I
delay
go.
because I spoke to him at the top of the show and there was no issue. So let's take him down and work on that. And in the meantime, let's carry on with the show. So yes, to tell you about the situation in Rwanda while we work with Albert's audio. Um, Again, right now the country is reporting 84 confirmed cases of coronavirus. As of yet, no deaths, which we are all grateful for. But this is a country with, okay, we're going, let's, we're clearly having
Am I
comms problems.
back?
Um,
Am
Apologies
I
to our viewers
fluent?
who are just joining us. We're clearly having comms problems. There's a massive delay, which is confusing everyone in the control room. So let's mute Albert while we figure that out and then and come back so that I can bring everyone up to speed with the situation in
On
Rwanda. If you're just joining us at home with Isha Sesay, it is a situation where we're dealing with some tech issues. But we are talking about Rwanda, and we're specifically looking at this small landlocked nation of some 12 million people, because, as I say, this had become this jewel on the continent, one with a reputation that was the envy of many other countries, with growth,
okay.
with a reputation for innovation, for tourism, for tech. And now they find themselves in a situation where tourism has essentially come to a standstill. Conferences can't take place. They've had to close their borders, and they do have a significant population that is poor, that is vulnerable. So the country now is trying to weather this pandemic, weather this storm. And as I said, the IMF has approved a loan of just over 109 million to the country. We hear Arthur again. Sorry, Arthur, Albert. Can you hear me? Okay. I'm not sure what's going on there, so we'll continue with that. So anyway, we want to get the latest on why this lockdown has been continued, why this lockdown has been extended in Rwanda. Of course, it was put in place March 21st. It was meant to end this weekend. Instead, what they find themselves dealing with is an extension by 2 weeks. One of the remarkable things about Rwanda is that the president, Paul Kagame, has instituted a support program to help the vulnerable, to provide staple foods. So, spaghetti and maize and other key products to help them in a time of need, because essentially, when you have a lockdown, the people it hits the hardest are the poor and the vulnerable, those who are involved in the informal sector, the informal economy, who have to go out every single day to find food, who have to go out every single day to trade, to make money so that they can feed themselves and feed their families in some cases. So what we've seen in Rwanda, which is remarkable, is this basically social safety net, which is being enacted by the government, where they're using the local community and their leaders to help compile lists, and so that those people on that list will get help. Albert, can you hear me? Hope springs eternal. Albert, do you hear me? My producer says you're back. I see no sign of that. No, he's not. So when he does pop up, I'll stop speaking. But till then, Rwanda's social safety net, which has kicked in to help feed the poor and the vulnerable, is remarkable.
Yes,
We have seen,
I can. I
articles
do.
written by people in neighboring Kenya where they've expressed admiration and
I do.
envy that they
Can you
have a
hear me?
program there in Rwanda that can help those in need.
I
The
do.
question is, of
I
course,
hear you.
how long does this
I'm back.
crisis go on for? And again, resources are finite. So, you can't just, in no country in the world could just keep that going indefinitely, which is why this money from the IMF of 109 million that has just been granted to Rwanda, the first country in Africa to receive emergency funding from the IMF, is so critically important. But for Rwanda, again, the question is testing. When it comes to this issue of testing for coronavirus, it is limited. Rwanda, like many other countries in Africa, needed those test kits provided by Jack Ma, the Chinese entrepreneur. They needed those to. They needed those test kits to be able to basically increase capacity to test the population. So those kits have been received by Rwanda and are making a difference there. I believe we have Albert back. I'm going to try again. I know that there's a crazy delay, I'm being told. So I'm going to pause after I speak for what may seem an eternity, but bear with us. Albert, do you hear me? I don't think we have him. Albert, do you hear me? Okay. This is one of those things. It might not be our day to speak to Albert in Kigali. I mean, it goes like that sometimes. But if he does pop up, I will bring him to you so you can hear from him directly about what is happening there on the ground in Rwanda. Because right now, clearly, there's something wrong with the connection, which is very, very odd. As I spoke to him at great length at the top of the hour, just before we went live, but it's still something's quite off right now. So, all right, let's move on. So that's the situation in Rwanda. If Albert reestablishes connection, I'll get you a live report from Kigali about what is happening there, how they're bearing up with this lockdown. It is one of the strictest. Kagame was one of the first presidents. In fact, I think he was the first president in sub-Saharan Africa to enforce a lockdown. So definitely want to know what conditions are like on the ground.
I'm from Kigali.
I definitely want to know what the conditions are on the ground there, and really how they're able to deal with this issue of social distancing.
There is so much
because Rwanda is one of those countries on the continent that has one of the highest population densities on the continent.
You don't hear me.
So the question of social distancing is particularly of importance there in Rwanda. How do you make that effective? How do you pull that off?
Of the Midwest,
still working to get him, but until he does come back, let's move on. Let me see if you've actually sent any comments that have come through.
I can't hear
I get this one from Michael Bruce. We can't hear Albert. Don't fail, Albert. Be there, please. Michael Bruce also asking, the social intervention for the poor in Rwanda is for how long? That's a really good question. I mean, that's what I was just saying, that it can't go on forever because resources are finite. Right, so Rwanda's asked for emergency funding. They've got it from the IMF, but again, how long is this pandemic going to go on for? Nobody has those answers, and so that is going to put a strain on national budgets, and everyone's probably doing their calculations right now to see how long they can help the poor, but it can't go on forever. If we can get Albert back, we'll ask him what the government projections are. And then we'll see what we can do with regards to the situation there in Rwanda when it comes to helping the vulnerable. Okay. Okay. Some people can hear him. They say he's there. We hear him. Okay, well, he's not coming through our speakers, which is super weird. Okay, so Michael Bruce, thank you for those messages. Keep your messages coming in, because that's the key part of this show. The fact that you send us your thoughts, what you like, what you don't like, the conversations that really resonate with you, the conversations that you have questions for, that you want me to share with the guests. Please send them back. People are seeing Albert online. It's very surreal. So our tech team is working to see what the situation is. But yeah, keep those questions, comments, thoughts coming in. This is just the first week of the show, so bear with us, in terms of the tech issues. We are literally working them out through the system. Every day we go live, we learn a new thing. But yeah, this is just the end of the first full week. So, we are innovating in real time with you because we believe this information is important. This comment from El Habib Stadi: Rwanda, beautiful country. I have visited, very safe country and beautiful. I actually went to Rwanda for the very first time a couple of weeks ago with the not-for-profit Giants of Africa. So we are seeing what the situation. It was interesting seeing it, the country with my own eyes, like Rwanda, a country that I've heard so much about. I agree with you. It was really, really beautiful. We don't just want to talk about Rwanda. There's more to come in the show today. We're going to talk about food security as well. You heard me say that in Rwanda, the government is giving food items to the poor and the vulnerable. It is important, these safety nets, especially at a time like this, because what we have seen is that in many places on the continent and beyond, prices have gone up for food. People are hoarding items. And so with that being the case, the question of or the threat of malnutrition, the question of hunger becomes more important, more critical, if you will. So this issue of food security is top of mind for me and for many, because Africa imports a lot of its food. That is incredibly difficult, if not impossible, at a time like this, given the fact that there's restriction on air travel and borders are closed, and many parts of the world are dealing with their own issues. So we on the continent import most of our food. Now that is increasingly difficult, which means that prices on the ground in countries are getting higher. It's not just the prices, people are also hoarding. So now there's a question of scarcity. So there's just a number of issues that we're dealing with on the continent when it comes to food security. We do have a chef, a well-renowned chef who is in Ghana, that we're hoping to bring to you, but my screen has gone completely blank. So I don't know whether she's there and whether she can join us. But I think one of the things that we have been focused on here on the show when it comes to the issue of food and food security or food insecurity is, what happens, what fills the gap that had been taken up with imported food items. I mean, the question of agriculture is one that. So that's my producer, my air saying we're trying to make connection with the chef in Ghana, Selassie Atadika. She's a well-renowned chef, and she is also an economist and has been doing a lot of work on this issue of food security, and has some really insightful comments that she wants to share with you, and guidance as to how we respond to this moment where we can't import as much food as we need. Agriculture is obviously going to be hit because people can't get out to pick what may be on the farms, what may be in the fields, because many countries are under lockdown. So there's that issue. There's a country like Kenya that is dealing with locusts as well. I mean, there are many things that are contributing to food insecurity right now on the continent. And I'm really hoping we can establish connection with my guest from Ghana, Selassie Atadika, so that she can talk to me about, how she sees us getting through this moment, how we get around this issue of, limited food, and, what, the poor and the vulnerable in particular could be doing at a time like this. So we're working to establish connection with her. Clearly, it is an issue that is not just about Rwanda and Albert, where we couldn't connect with him. There's something going on because all our guests are struggling to come through right now, and I'm not entirely sure why that is, but we're going to keep going, and hopefully someone is going to pop up. Otherwise, you're just going to have to hang out with me, because I do have a lot to tell you about. So with or without guests, we can hang out. Let me see if you've sent any more comments. This one from Bruhan, well, that just went by. Bruhan asked, how is this going to end? Bruhan Dabo, Mrs. Say, how long is this going to end in Africa, because Africa's healthy systems are poor? No, I understand where you're going with that, Bruhan. I mean, that's the question. How long is this going to go on for? Nobody knows. If you're joining me and you're watching the show from the comfort of your home, I hope you're safe and well. I am locked up in my home here in LA. I have been in lockdown for about 2 weeks, been unable to leave. I could go to the supermarket or to the pharmacy because you can go out for essentials, but I've been reluctant to do so just because the guidance is stay indoors, and nobody can really project how long this is going to play out for. The hope is that if societies, that's globally, if people observe the social distancing rules that are put in place, if these lockdowns are successful, that we can begin to flatten the curve, which you may have heard about. We can begin to reduce the rate of transmission. That's the hope. And until we can do that and get transmissions down, or at least to a manageable, containable level, this thing will go on. So nobody knows when the end is in sight, Bruhan, and that's the real worry, because Africa does not have the capacity for a disease like this that is leaving so many people so very, very sick, and leaving so many people needing hospital care and hospital beds and ventilators. So it is a great worry. Haruna Sumer says, "Can we predict that COVID will strain food security?" Yeah, I think we can. If you find yourself in a situation where, as a country, you import most of your food and you can't import, if people can't get out to the fields to harvest, to plant, that means there's less local produce making it to the market. If people are hoarding and prices are going up, then people can't afford they either can't find food items, or they can't afford the items that are on the market. That's food insecurity. That is all a strain that affects what people eat, what they can eat. So yes, that's absolutely a situation that I think we can predict, because we're seeing it in countries. Somebody else sending other comments: why are most African countries struggling to provide palliatives for their people at this time? This is from Nedu Ekawonya. I think that's a conversation that we certainly want to have with government representatives, with African leaders. Why are we in a situation where a country like Rwanda is in the minority in terms of providing these kinds of support for the poor and the vulnerable? I mean, largely it comes down to budgets, it comes down to money and the ability to do that. And of course, there are countries that on the continent, many of which are low middle income, and they strain under such a load. But it is something we need to see more of, given the significant proportion of our populations that are poor and vulnerable. We need to see more safety nets put in place. Let me see if Albert is here, because I just heard in my ear that he might actually be back. Albert, can you hear me? Nope. Albert, are you there? If you're not there, then we should move on and bring in the doctor and bring... Albert, are you there? Nope, he's not responding. Albert, are you there? Can you hear me? I'm being told that you're there. No. This is very, very strange. Okay, we're using different software to broadcast to you today, so we're clearly having some teething problems. We're using something different from what we've used for the past 7 days. So it's very odd. We don't have Albert, clearly. Albert, are you there? Okay. Let's see if he pops up, and if he does suddenly appear, if we suddenly hear him, I'll stop speaking. But till then, let's keep going. I want to take a moment as we talk about this pandemic on the continent, which has now brought about over 100 deaths on the continent. The latest numbers the latest numbers that we're seeing reported by the BBC, and they're getting their numbers from Johns Hopkins University, is over 7,000 confirmed cases, 292 deaths on the continent. The World Health Organization had warned a couple of days ago that the world would see over a million cases, that they would hit a million cases, before the end of this week, and sadly that has come to pass. We are seeing over a million cases of coronavirus worldwide. To give you the very latest number, as reported by Johns Hopkins University, and they're collating this information, and they're a source for the numbers for most organizations. Their latest number is 1,066,700. Just over 1 million cases confirmed in the world. When you look at the US, you're looking at 258,214 as reported by Johns Hopkins. To put that in context, when you look at Africa, you're looking at over 7,419 total confirmed cases. In fact, that number just jumped as the computer refreshed, 317 confirmed deaths now. This disease is surging. It's surging through the world, and nobody knows, excuse me, when this is going to end. I want to bring in an epidemiologist to get some perspective on what is happening in Africa in terms of the density of the spread. So let's try this and see if Dr. Moses Katabawa can hear me. Can you hear me, Moses? I am just out of luck today. Moses, can you hear me? Moses has done extensive work around eliminating river blindness on the continent and around the world, and he's joining us from Atlanta. He's an epidemiologist and an adjunct professor at Emory University, and I really want to get a sense from him about how we can know for sure. It's not so much a question of we know that the case is not accurate, the picture is not accurate from the continent in terms of the spread, because we're just not testing enough. But one of the things that has been said by a number of scientists is that Africa is heading for catastrophe because of the population density, and just because of our healthcare systems being so fragile in many places. Dr. Moses Katabawa has a slightly different perspective on this, so I'm hoping he can join to tell us more and how he can be certain that things will not be as bad as so many people are saying. So I'm hoping he can join us to talk to us about that. In terms of testing, we know that in the case of Nigeria, they've seen a 32% increase in testing, but that's just not enough. We need to know more. One of the things we're also seeing on the continent is that people are there's testing going on, but the issue of social distancing is challenging. Where people live in informal settlements, where people live in slums, it's hard to keep people apart when people feel they have to go out to find something that they will use. They have to go out to find some means of supporting themselves in the informal economy. It's hard to get them to abide by the enforcement of the lockdowns. So lots and lots of issues that affect the trajectory of this disease, which is why I want to speak to Dr. Katabawa about the modeling and what that shows for Africa right now, given these issues of population density, fragile healthcare systems, lockdowns that aren't necessarily being abided by all because people have to go out. People need to go out and find money so they can feed themselves and their families. So I do want to talk to him about that and see what he has to say. And also this question about the urban-rural areas. We talk a lot about the urban areas because there are a lot of labs in urban areas, in the big cities, in Accra, in Kumasi, in Freetown, in Lagos, in Abuja, in Kigali. We know that they're there. But what about in the rural areas? What testing is going on there? I think that's a major question we have to ask ourselves, because that's a major blind spot. And I think one of the concerns that I've read about that a lot of people have is, how do you know that you've got the situation under control and can go ahead and relax your restrictive measures if you don't have a full picture of the country? So you may say, I only have 200 confirmed cases, but if you're not testing widely, how do you know when it is time to, how do you know when the time is to lift those restrictions? It makes it very difficult for governments to make their decisions and to know how to react and when to react if you're not testing fully. Let's see if Dr. Moses Katabawa is there. Doc, can you hear me? Goodness me. I know everyone in the control room is scrambling because they're trying to make connection with Kigali, with Accra, with Atlanta, and so far coming up with Bobkiss, as my mom would say. So yeah, in terms of cases on the continent, right now, South Africa is still leading the way with over 1,400 cases, by far ahead on the continent of having the most coronavirus cases. They are now ramping up their testing. We've seen in the last 48 hours reports of door-to-door testing in South Africa, which is what we want to see. We want to see every country that has capacity to step up that testing so we can get a true picture of the spread of this disease. So South Africa definitely ramping up their efforts to increase the number of people that are getting tested so that they can look at their population and be able to say with a greater degree of certainty how much this disease has spread in their country. So that was a major, major move on the part of South Africa to be able to get to the place of door-to-door testing. Their lockdown still remains in place. South Africa leading the way. There are still countries on the continent that aren't reporting any confirmed cases of coronavirus, which I have to say I was grateful for. I am grateful for, and I was surprised by. I took a look at where that is, and these are the countries that show up on the tracker. See if you thought any of these people would be on this list. South Sudan, Sao Tome, Lesotho, Comoros, and the disputed territory of Western Sahara. So that's 1, 2, 3, 4, 5. 4 countries in a disputed territory that are not reporting any cases of coronavirus. South Africa at the other end of the scale, 1,400 plus cases, but five places on the continent right now reporting no cases of coronavirus. Sierra Leone had been part of that list. You may remember if you were with us during this week. I'm from Sierra Leone, and they have sadly now reported 2 confirmed cases of coronavirus. And so that situation changed quickly, the country heading for their own lockdown of 3 days in a bid to get a clearer picture of what's happening there. But yeah, there are still countries on the continent that do not have any cases of coronavirus. South Africa leading the way with 1,400. But again, it's important to put it in context. You look at the United States, and the latest number, according to Johns Hopkins, as the computer refreshes, is over 258,214 confirmed cases of coronavirus here in the United States, where I am right now. So that's the situation there in South Africa and in other places on the continent. Let's see if you've sent any comments. Oh gosh, so many. All right, so let's see. Okay, let me bring you there. This from Haruna Sumer, and thank you for continuing to write in. Can we be concerned that food security strain would destabilize countries or perhaps regions? That's something that we want to put to experts. I mean, I think that's the fear, right? That's the fear. If people are hungry, if people are desperate, things can get out of hand very quickly. That is not what we want to see on the continent, not in any way, shape, or form. We do not want to see instability, but that is a very real threat with, food shortages, food price hikes, and people, locked indoors and unable to go out and make any money to support themselves. So that's the concern, and every African government is going to be aware of that. When we spoke to Thomas Naibo from Goma in Eastern DRC a couple of days ago, he said they were saying there that they can't put a lockdown in place because they were concerned that people would starve or they would riot. So this is real. These are the concerns that people have. These are the concerns that governments are dealing with. This concern that these restrictive measures and this food shortages, price hikes, and people being hungry could cause instability. So it's a risk. It's a risk. Um, Nedu Ekowonya, Nigeria is beginning to look inwardly in the production of test kits and ventilators. Thank you for writing in, Nedu, Haruna, everybody who sent comments. That's what we need, right? We need to, where possible on the continent, produce these kits. We need to create our own local production chains because the whole world is searching for kits, right? So they are in limited supply and everybody is going after them. So we have to look to see what we can do domestically to get our own kits. In I know that in I know that in Senegal, they are working there at the Pasteur Institute. They're working with Mologic, a British company, to create a test, one that would give results fairly quickly. And so work is underway to try and bring that to market. And the thinking is that they would actually manufacture kits in Senegal and also beyond the continent. So I'm glad to hear that Nigeria is beginning to look inwardly in the production of test kits and ventilators. According to Nede Ekwonya, thank you so much. Kerwin's Kerwin Sr. Is saying good morning from Phoenix, Arizona. Good morning. Thank you for joining us. Yeah, still morning. It's 11:36 so far here on the West Coast. This from Alimami Ralph Sesay. Are we related, Alimami? Saying kudos, Sister Aisha. Thank you, brother. I appreciate that. Apologies for the fact that we haven't been able to bring you any guests. Clearly, the entire system has crashed, but lucky for you, I can talk until the world comes to an end. So, well, maybe not lucky for you, but anyway. Stay with me. This from Queen D. Social distancing will not be very effective in Africa because most people's survival depends on them working outside to make a living. What do you guys think about this issue of social distancing? That's the view of Queen D. Let's have this conversation. Tell me, do you agree with that? I mean, I certainly think it's problematic and it's going to be hard to make a reality successfully. What do you think? What are your thoughts on this issue of social distancing? This show is all about this conversation that we're having right now. It's all about me reading your comments, us sharing and exchanging points of view, and when we have guests, putting your comments to the guests as well. So please keep your messages coming. It's really one of the reasons why I'm doing this show, because everyone could be doing other things at this point in time. I'm grateful to you that you chose to spend this hour with me on this Friday. And I'm doing the show because I think that there's more information that needs to be shared when it comes to Africa and the coronavirus pandemic, and that there just isn't enough, and that we need more voices. We need your voices out there. We need the voices of experts and decision makers and community leaders and innovators. And that's why I'm doing this show, because really I think that, everyone needs to step up and do their part in this moment. So I want to hear what you think about this issue of social distancing. I want to hear if you think that the issue of food insecurity is real where you are living, what your fears are if you're on the continent right now. What is worrying you the most when it comes to this pandemic? Share your thoughts with me so I can share them with everyone, and we can discuss further. Queen D, I'm from Sierra Leone too. We were on coronavirus free list until earlier this week. I'm glad the numbers are still low, and hopefully with the lockdown they can handle the situation. Queen D, I am right there with you. As we would say in Sierra Leone, Sister Yeriu. That's what we would say. I too am hoping that the situation can be brought under control very, very quickly. I was concerned though when I spoke to Umaru Fofana, who was on the show earlier on in the week and told us about the first confirmed coronavirus case. And he was telling us that one of the local quarantine sites, a hotel that had been designated to quarantine returning, whether you're returning or just essentially travelers coming into Freetown, that they had left it open and people could socialize and mingle. That's very worrying when you're talking about a disease that's so highly contagious, because it means if anybody had it, they could have spread it to more than they could have spread it to people who are around. This is a disease that is infecting, 2 to 3 people. So one person can infect 2 to 3 people. So I'm hoping, Queen D, that these numbers can stay low. I'm really hoping that anyone who's come into contact with the confirmed cases can be traced quickly and tested and isolated. Judith Monsanti says, I would agree. I'm from Malawi, and social distancing is a problem for majority of Malawians. Yeah, no, listen, it's a problem in Sierra Leone. It's a problem when you think about townships in South Africa. It's a problem when you think about, slums in Kenya. It's a problem in many areas. Even if it's not a case of an informal settlement or even a slum, it's just about, you know, um, the way our cities are built, the way, kind of planning, if, and what that means in terms of how closely we live next to our neighbors. So it's an issue. It's an issue, and it makes it very problematic to get this kind of situation under control. Carrara has written, out of our continent, researchers to test vaccination in Africa. Carrara, can you resend that so I can follow that clearly? Because I can't. Out of our continent, researchers to test vaccination in Africa. So, Judith Mosonthi, most Africans survive on a daily income. Abu Bakr Awaz Bar, hope the government of Sierra Leone continues to sensitize people to maintain social distancing. I'm with you, brother. E News 24/7, the way the African society is structured, a lockdown will be difficult. People will revolt. I'm hoping people don't revolt. I mean, I'm hoping that people understand. Again, it's not just about understanding, but that they get the support they need to be able to follow these guidelines and accept these restrictions, because it's for everybody's good. Let me see if the doctor is there, Dr. Moses Katabawa, who is joining us from Atlanta. Dr. Katabawa, can you hear me? Nope. He said apparently he can hear me, but we can't hear him. So there's something somewhere, something is not working. Let's see your other comments. So there's this you may have seen this, and people are commenting on it. So I'd love to hear your opinions on this. You may have seen it's been reported widely, and you'd have seen the clips if you went online of these 2 French doctors on French TV, basically talking about testing a vaccine in Africa. And, kind of like, why don't we just go to Africa and test the vaccine? And, it has led to, a firestorm, as it rightly should. The French Medical Institute, I wouldn't say it's called INSERM. They're saying that the comments have been misinterpreted and misconstrued. But, if you've seen the clip, send me your thoughts. What do you make of it? This kind of, to me, it struck me as very cavalier, and there's a sense of disregard for Africans. Like, let's just, jump on a plane and go to Africa and test the vaccine, and see how we get on. So go online, check out the video, send your thoughts, because I really want to hear what you think. That not everyone agrees. Some people say, go wherever you want, be it Africa or wherever it is, as long as you give people the information, as long as you compensate them, as long as they have access to healthcare, and want to take part in a trial, let them. That what they're saying is no different from what actually takes place around the world, and the trials are being held. I don't know that I agree with that point of view. There was something in the phraseology and the exchange that struck me as very troubling, but I want to hear what you think. Michael Bruce, though the lockdown is good, it's not sustainable. Most folks are in informal sector. Let's see. Abby A, yes, it was on the BBC World Service. Thank you, Abby A. Lots of comments coming, and I'm so grateful. Let's see. Let me refresh this. New messages. Okay, this one from Hassan Bundu. I just spoke to a family member from Freetown, and she said she went to grab some food items for the 3 days lockdown, and people were queued in lines with no social distancing. Yeah, we've heard that kind of thing again. It makes me wonder when this will all end, right? It makes me wonder. Now, I want to be very clear though. I saw a picture today from a train in New York where people were packed like sardines. And I thought the same thing. I thought the same thing. I was like, where on earth, or better yet, how on earth is this going to end? So again, I think it's always important to have context and to put Africa in a broader context. It's not just Africa. Different reasons are causing the failure of social distancing to be effectively enforced or followed, rather. But I just saw pictures also in New York where there were people crammed like sardines. So everywhere around the world, people have to take these guidelines seriously, and where it's the case of the poor and the vulnerable who out of necessity feel or actually need to go out to find income, they need to be supported to whatever degree governments can, because otherwise I'm going to be locked up in this apartment forever, and this lockdown is going to go on. And okay, and Carrara, in reference to what we were talking about with the vaccine, says we have to clearly say no to any test in Africa. Listen, I'm with you. It gives me great anxiety to hear that kind of cavalier conversation being had about, let's just go off to Africa and test on Africans. Um, we're going to get some people on, we're going to even try and reach out and get maybe somebody who's been involved in the actual organization of vaccine trials to kind of tell us a little bit more about the protocols involved. But, I didn't, it troubled me. It definitely troubled me. There's no doubt about that. It troubled me. Okay, so this one, I'm going to read only a few more. And then what I'm going to do is, because we're having so many technical issues, sometimes you got to know when to quit. I'm going to head to Instagram. So I'm going to read a few more comments, and then I'm going to also share a couple of things, because I do want to tell you the sad news about a doctor that everyone's calling a living legend who passed away due to COVID-19. I'm going to tell you about him. A few more comments, then we're going to acknowledge the loss that so many people are dealing with now because of this disease. Then we're going to wrap the show, and you're going to come meet me on Instagram, because I do have Banky Wellington, and that's still happening. If one door closes, go through another one. And that's what we're going to do. This door is going to close, and we're going to go to Instagram in a couple of minutes. So just a few last comments that I want to share with you, because you've taken the time to write in. And so I want to share your thoughts with everyone. Abu Bakr Awaz Bar, it's not only in New York, even in Sierra Leone, people are so clustered in the market area. That's such a bad idea. How about they try those vaccines in China or the US? Yeah, it was just really very disturbing exchange. I'm trying to see anyone else who sent E News 24/7. The ripple effect of that packed train is what New York is experiencing now. It's true. I mean, here in the United States, the big conversation is, why don't they just issue a nationwide lockdown? Why don't we have something that's in place in places like Rwanda or South Africa? Just lock the country down, make everyone shelter in place, and then we can get the situation under control. But we see in the US it's problematic, and it's problematic in Africa. All right, that's it for comments today. Thank you so much for taking the time to write in. We are going to wrap the show, but before I go, I do want to tell you about Dr. Alpha Sadhu, who died Tuesday from complications with COVID-19. Many people who knew him calling him a living legend. He worked in the British National Health Service, the NHS, was known for his compassion and his love of all, and just loved being a doctor, loved talking about medicine. His son has come out and spoken about the fact that his dad refused to go to the hospital, saying he didn't want to take up a hospital bed because others would need it. So he did not go to the hospital because he did not want to take up a hospital bed, because he knew that there's a great demand for beds, and he lost the fight to COVID-19 after battling the disease for 2 weeks. He was 68 years old. Um, our thoughts and prayers are with his family. This is a very difficult time for so many people, for so many reasons. And on this show, every day we are going to share details of those who've lost the battles of COVID-19, because we want them to be remembered. We want them to be known. We want to share the details about them that we have. Because, as I say, every day, if you watched the show before, you've heard me say every person leaves a hole in the lives of those who knew them, those who loved them, those who are grieving for them. And so at this point in time, all we can do is send them our thoughts and our prayers, and send our condolences. With that being said, a lot of doctors and nurses around the world are on the front lines. In Africa, we don't have enough of them, but they are still going to work in many places. They are still doing the important work of caring for the sick. I would love for you guys to send messages of support, to send, whether it's in video or text, whatever you want to send, whatever messages of encouragement you want to send to our healthcare workers, our healthcare providers, so that we can support them and encourage them. We need them now more than ever. So, I encourage you to send me your messages so I can read them out and we can share them. You can send them to I am Isha Sesay. That's on Instagram and on Twitter. And we really want to know that we want them to know that they're appreciated. The doctors, the nurses, anyone who's working in the medical field right now, these are very dangerous times. These people have lives. In many cases, they have families. They have their own wives, their own children, their own husband, their own children, and they're brothers and sisters of people. They're someone's children. So send your messages of support for Africa's healthcare workers. Let's share them. This show is about community. It's about compassion. It's about us pulling together during this very, very difficult moment. I thank you for spending the last 51 minutes with me. We did not have the guest that we worked so hard to bring to you due to technical difficulties. Banky Wellington is our bright side. He is going to join me on Instagram in about 2 minutes. I'm going to log off here, log on to Instagram. That's a conversation that's going to share with us how he's dealing with life right now. As you guys know, he's a Nollywood royalty. He's a singer. He's an actor. He's a rapper. He's an entrepreneur. He's a philanthropist. He's doing a lot. He's in Lagos right now. He's waiting to join me on Instagram. Log off from Facebook, Twitter, and YouTube. Join me on Instagram in a couple of minutes. And let's talk to Banky. Let's get that conversation going. Send me your thoughts. Send me your messages. Send me your comments. And let's do it. I want to thank you all for joining me here. Even without the guests, I hope you found it insightful. I hope you'll join me next week. We have all weekend to work on the tech. All weekend. Nobody's getting a break on this team because we're going to be trying to figure out what happened today so it doesn't happen again. And we'll be back next week with a brand new show with connections that work. And, once more coming together, lifting each other up, sharing information that we need now more than ever. So thank you. Be well wherever you are. Be safe. Follow the guidelines. Stay indoors if you can. Join us next week. Same time, same place. We'll be back on YouTube, Twitter, and Facebook, YouTube, Twitter. Join me next week. Send those messages of support for Africa's healthcare workers so we can share them and make sure that they know that they're appreciated. See you on Instagram in 2 minutes. 2 minutes. I will see you there. I'm going to log off on the system, get on my phone, and get chatting to Banky Wellington. Thank you, everyone. Be safe. Have a good weekend. Bye for now.